Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover stretching the latissimus dorsi muscle in the supine position. That means laying face up. The latissimus dorsi is a big, powerful muscle. It has a very broad origin. Its origins are the spinous process of the lower thoracic spine, the thoracolumbar fascia, the iliac crest, some of the posterior ribs, and in some of the literature it even says the inferior tip of the scapula. And it inserts onto the arm at the intertubercular groove. The latissimus dorsi muscle performs internal rotation of the shoulder, adduction of the shoulder, and extension of the shoulder. Internal rotation of the shoulder is performed by the latissimus dorsi muscle along with the Teres major and the Subscapularis muscles. The latissimus dorsi muscle is innervated by the thoracodorsal nerve, which receives its innervation from vertebral levels C5, C6, C7, and in some literature it even says C8. Stretching the latissimus dorsi muscle is very important. If the latissimus dorsi muscle, known as the lats in the gym, if the lats are tight, they can cause poor posture. They can also be a precursor to dysfunction in the shoulder, in the lower mid-back, and in the low back. I already did a video on stretching the latissimus dorsi muscle in the standing position. So in this video, I'm going to go over stretching the latissimus dorsi muscle in a supine position. You can test the length of the latissimus dorsi muscles and the teres major muscles in a supine position. You're laying flat on your back. You want to make sure that the pelvis is contacting the table and that your lumbar spine and lower thoracic spine are contacting the table. You're going to flex both shoulders so that you are raising your hands overhead. The arms should reach parallel to the table or lower. If they do not, then there is hypertonicity of the latissimus dorsi muscles and the teres major muscle. If you lift the pelvis off the floor, or if you arch the low back to cheat to be able to reach that area, then most likely there is shortening or tightness, or what we call hypertonicity in medical terminology, of the latissimus dorsi muscles and the teres major muscles. I'm going to go over how to stretch the latissimus dorsi muscle in a supine position. Then I'm going to go over how to stretch the latissimus dorsi muscle using a foam roller when you are in the supine position. As you can see, I am on a chiropractic table. This can be done on an exercise bench. This can be done on a training table or a chiropractic table. You can even do it on the floor, but it is not as effective when you do it on the floor. What you want to do is keep the posterior aspect of the pelvis and contacting the table, and keep the lower part of the thoracic spine and the lumbar spine contacting the table. Bring your arms overhead as far as you can. Let the shoulder blades fall towards the table, and you want to just relax your arms. Now you may already feel a stretch in this position, and that's okay. But what you're going to do, we're going to be stretching one side at a time. So I'm going to demonstrate stretching the right hand side. So you're going to take the left wrist and you're going to pull the right wrist superior and in the opposite direction. So you're pulling at this angle. And once you feel a mild, comfortable stretch in the latissimus dorsi muscle, hold that stretch anywhere from 10 to 120 seconds. You have to find the time frame that works best for you. Once you have completed the stretch, move out of the stretch slowly and then perform it on the opposite side. You can use the foam roller as an advanced version of stretching the latissimus dorsi muscles in the supine position. As you could say, I am laying with the foam roller positioned vertically along my spine. You always want to make sure that the sacrum is supported and that the back of the head is supported. You never want to have any part of the spine unsupported when you are on the foam roller. So you want to make sure that the sacrum is supported and the back of the head is supported on the foam roller. That is extremely important. Then you're going to perform the same stretch that you just performed. The general stretching rules apply for this stretch. Those rules include move into the stretch slowly, hold a mild, comfortable stretch, and return from the stretch slowly. If any stretch or exercise elicits pain or intensifies pain or symptoms, you want to stop that stretch immediately and find a viable substitute or modify the stretch so it does not elicit or intensify pain or symptoms. To stretch the latissimus dorsi muscle in the supine position with the foam roller running vertical along the spine, you want to make sure that the lower part of your thoracic spine is always contacting the foam roller. You're going to flex the shoulders overhead as far as you can. You want to let your shoulder blades fall downwards so they wrap around the roller. Now you may feel a stretch in this position. If you do, just hold that stretch. The next step is to stretch superior, so you're stretching overhead, and posterior at the same time. So you are letting the shoulder blades and the shoulders fall towards the floor as you are reaching as far as you can overhead. Now you may not feel the stretch in the latissimus dorsi muscle. You may feel it right now in the anterior rib cage muscles or in the subscapularis or in the chest muscles, and that is perfectly fine. But then to stretch the latissimus dorsi muscle, I'm going to demonstrate with the right hand. You're going to use the left hand and you're going to grab the right wrist, and again, let that shoulder fall down towards the floor and keep your lower thoracic spine contacting the foam roller. And you're going to use your left hand to stretch your right arm superior and across the body. So you are stretching in this direction and in this direction. And when you feel a mild, comfortable stretch in the latissimus dorsi muscles, stop and hold that position anywhere from 10 to 120 seconds. You have to find the time frame that works best for you. For me, it is 30 to 60 seconds. And then when you are done, move out of the stretch slowly and then perform the same stretch on the opposite side. Even if your injury is only on one side, you still want to stretch both sides. Thanks everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered stretching the latissimus dorsi muscle in a supine position. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on my book, and you can also see my blog. My blog contains articles on spine health, sports medicine, fitness, and health. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, you are on my YouTube page. Always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.